In the laboratory, we measure ventilation using devices called spirometers, which measure volumes of air moved through the respiratory system. There are 4 volumes of interest that we will focus on, measured at very specific points during the respiratory cycle. The first is tidal volume, which is the typical volume of air moved during normal quiet breathing when we are at rest. Tidal volume averages 500 milliliters for adults, both male and female. Inspiratory reserve volume is the volume that can be forcibly inhaled beyond tidal volume, while expiratory reserve volume is the volume of air that can be forcibly exhaled beyond tidal volume. Residual volume is the volume of air remaining in the lungs after a forceful exhalation. This volume remains in the lungs in order to keep the alveoli inflated between breaths. Since it remains in the lungs, it cannot be directly measured, but instead must be estimated using equations that take into account the variables of gender, age, and height. There are also 2 respiratory capacities of interest. A respiratory capacity is obtained from adding 2 or more respiratory volumes together. Vital capacity, which may also be referred to as forced vital capacity, is the amount of air that can be exhaled after a forceful inhalation. It is the sum of tidal volume, inspiratory reserve volume, and expiratory reserve volume. Total lung capacity is the total amount of air a person can hold within their lungs after a forceful inhalation. It is the sum of all 4 of the respiratory volumes that we examined previously, or more simply, it is the sum of vital capacity plus residual volume. An average adult female has approximately 4,200 milliliters of total lung capacity, while an average adult male has about 6,000 milliliters of total lung capacity. The movement of air through the respiratory pathways encounters resistance to flow and can be described using Poiseuille's law, in the same way that the resistance of blood vessels altered blood pressure and blood flow. Just as with blood flow, airflow is described by Poiseuille's law and is influenced by the change in pressure over the resistance to that flow. The radius or the diameter of the airways plays a significant role in the resistance to airflow. An increase in the airway radius or diameter will decrease the resistance, but will increase the flow as a result. Since resistance is in the denominator of the equation above, any decrease in the resistance will increase airflow. Likewise, if there is a decrease in the airway radius or diameter, that will increase the resistance and overall serve to decrease the airflow through the system. Asthma, which can be acute or chronic, is caused by inflammation and spasms of the bronchioles that cause airway radius to decrease, thereby increasing resistance to airflow and reduces airflow to the alveoli, making it more difficult for the affected individual to breathe. Causes of asthma include environmental factors such as dust, pet hair, smoke, and other irritants, or can be caused by stress or even exercise.